right, Dr. Iskander, you know what's coming up? Mother's Day.
Yes.
And I think a really great gift would be the gift of eyesight. Don't you think that's a good idea?
I totally agree. LASIK would be a very good idea.
Okay, well, you know what? I know that mothers come in all different kinds of ages. We're talking about the CZ LASIK laser. Is that correct? Talk to us about it.
This is LASIK using the Carl Zeiss excimer laser technology.
Okay.
This is the only laser in Texas, and it's the finest laser beam available on the U.S. market.
Okay, now is this laser okay to use on anybody? I'm talking about moms here.
Yes. If you're a good candidate for LASIK, you should be a good candidate for CZ LASIK.
Okay, well, what defines a good candidate then?
Not everyone is a good candidate.
Okay, good to know.
You have to be in range for the treatment. Your corneas have to be healthy enough for the treatment.
How long does it take?
Oh, the lasers take seconds, actually. Total in the procedure room about 10 minutes.
Really? And so as soon as you get up from the procedure room, are you seeing 20/20 vision?
You can see very well. It's a little bit foggy. The next day, most of the patients are 20/20. They can drive themselves back to work. They can go back to work. They can do most activities that they usually do.
And what kind of responses have you got from your patients?
Oh, they're ecstatic. You're going to meet some of them today, and they're ecstatic.
Very good. I'm sure their quality of life has just gone from night and day.
Absolutely. It's a very fulfilling procedure for both the doctor and the patient.
Dr. Iskander and his staff made me feel very comfortable. They walked me through the entire procedure step by step, which is exactly what I needed. It was about 10 seconds per eye. He walked me through, and then boom, I was done. I was actually very shocked that the next day when I woke up, I was able to go to work and function completely. When I came in for my follow-up appointment the next day, I was seeing better than 20/20.
Well, I'm a commercial diver by trade, and whenever you're working offshore, your hands are always messy and you don't want to mess with contacts every night, so it's much more convenient to have this now. It's like a 15-minute surgery and you're completely done. Yeah, when I woke up the next morning, I was 20/20, less than 12 hours later.
I was wearing contact lenses, and I was wearing glasses and prescribed sunglasses as well, and I had astigmatism. The freedom of not having to deal with that anymore and being able to see is just amazing. I actually just got my procedure done last year, and the only thing I regret is not doing it any sooner.
Dr. Iskander, let me ask you this. I know there's a lot of folks who are maybe hesitant or kind of nervous to come and see the eye doctor. How would you encourage them to come in and come in for a consultation?
I think everyone should have an eye exam once a year. The eye is like any part of the body. You just need to examine your eye once a year. And I encourage them to come and see us. We have the latest technology, and we would be able to tell them whether there are candidates for any vision correction procedure or even for just general eye care.
Good to know. Well, thanks for having us out here.
You're very welcome. Thank you for being here.